Hi, my name's Joanna, and I'm going to be performing a cardiac examination. First, I'm going to wash my hands. I'll be showing you the 6 precordial areas. First is the aortic area, which is the second intercostal space, right to the mid-sternal border. This is where S2s hurt the best. And then this is the pulmonic area, which is second intercostal space, left to the sternal border. This is where split S2s hurt the best. Then the Erb's point, which is the third intercostal space, left to the sternal border. Then the tricuspid, which is the fourth intercostal space, left to the sternal border. This is where split S1s hurt the best. Then there's the mitral area, which is the fifth intercostal space, mid-clavicular line to the left side. This is where the mitral area is and where S1s hurt the best. Then the epigastric area, which is right below the xiphoid process, slightly to the left. S3, S4 in mitral valve prolapse would be heard over the mitral area, which is the fifth intercostal space, left mid-clavicular line, with the patient lying left lateral decubitus position. Also, mitral regurgitation and aortic stenosis will be both heard during systole. And then I'm going to perform the squat test, which is with the patient sitting up. I would heard over the mitral area, which is the fifth intercostal space, mid-clavicular line. And I would listen to the mitral area. As the patient would be squatting, now I would be listening for a clicking sound. If the sound diminishes, that means there could be a mitral valve prolapse. But if the click accentuates, that could be could be hurting the opening snaps from aortic stenosis. Then I'm going to show you the Valsalva maneuver where the patient's laying down. Thank you again. Again, I would be listening to the mitral area, which is the fifth intercostal space, left mid-clavicular line. I would also put my hand on her abdomen and I would ask the patient to bear down or strain as if she was going to have a bowel movement. Then I would be listening for the sound. If the sound would be louder while the patient's straining, that could mean there's a mitral valve prolapse. But if the sound diminishes, that could mean aortic stenosis. Then I would inspect for pulsations over the precordial areas. Then with using the pad of my fingers, I would feel for leaves or heaves over the areas. Then I would palpate for thrills or pulsations using the ball of my hands. I would look for vibratory sensations that could indicate murmurs. Now, I'm also going to show you the apical pulse, which is the pulmomaximal impulse. That is the fifth intercostal space. Again, left to mid-clavicular line. Here, I would listen for a pulsation that is about 2 to 2.5 centimeters wide. It would be brisk, and it would be felt 2/3 systole. Now, if the apical impulse would be laterally displaced, that could mean that there's a pregnancy, there's an enlarged heart, cardiomyopathy, ischemic heart disease. If the area would be wider or diffuse, that could mean there's an enlarged heart. If the apical pulse is sustained, that could mean left ventricular hypertrophy. If it's hyperdynamic or hyperkinetic, it would be normal in young or recent exercise, hyperthyroidism, anemia, aortic stenosis, and aortic regurgitation. Then I'm going to also state for the 5 precordial points. First, I'm going to be using the diaphragm on my stethoscope. Then I'll be using the bell of my stethoscope. Only heard S1 and S2, no S3, no S4, no murmurs, no rubs or gallops. Then I'm gonna have the patient go to the sitting up and sort of lean forward. I'll be listening again with the diaphragm of my stethoscope. Now using my bell. Only heard S1 and S2, no S3 or S4, no murmurs, gallops, or rubs. Then I'm gonna have the patient lean over to the left side, which is the left lateral, the cubitus position. I would be using the diaphragm as well. Then I'll be using the bell of the stethoscope. Only heard S1 and S2, no S3, no murmurs, no gallops or rubs. And then I'm gonna have her lay supine again. Now I'm listening to her arteries. First, I'm gonna start with her carotids. I'll be listening with the bell of my stethoscope. I'm gonna have the patient hold her breath. So hold your breath, and then I'm gonna be listening. For bruits, no bruit hurt. Then I'm gonna do the abdominal artery, which is right in between the xiphoid process and the umbilicus. Again, using the bell. Again, no bruits. Then I'm gonna do the renal, which would be left lateral to midline. Well, left would be on this side. And then right lateral to midline. Then no bruits hurt. Then I'm gonna do the iliac, right below the umbilicus, slightly lateral to midline. No bruits hurt. And lastly, the femoral arteries, which is right between the iliac crest and the pubis symphysis, within the groin. And no bruits hurts. And that concludes the examination.